So today we are starting the discussion of, and we will start from the lower part. सबसे पहले हम lower part से start करेंगे, means hip joint and the legs, right? There are many patients are coming to us with the problems of the hip joint, ABN of hip, avascular necrosis of the hip, osteoarthritis of the knee, rheumatoid arthritis of the knee, pain in the ankle joint, ACL tear, PCL tear, means anterior cruciate ligament tear. So we should have the idea about these all structures and their movements. So first, let's quickly, I will share you about the few bones. So this is the femur bone.
Good, sir.
This joint is called hip joint. What is the name of the joint?
Hip joint.
When the patient coming to doctor, I am suffering with ABN of hip. The meaning of ABN of hip means there is no blood supply to this part of the femur bone. So there is a problem happening in this joint, ABN of hip. ABN, how many person has listened the name of ABN? कितने लोगों ने ABN का नाम सुना है?
सर सुना है, मेरे कजन को भी है वो प्रॉब्लम।
सुना है ना?
Yes, sir.
So the person is taking too much steroids. They are suffering with they might suffer with ABN because steroids are having effect, osteoporotic effect. They are reducing the bone density, steroids.
सर वो है ना, प्रोटीन पाउडर बहुत इनटेक करता था।
हाँ, बिल्कुल वो actually
जिम बहुत
not only
करता
protein
था।
powder. Protein powder will not create this problem, but maybe many person are very health seeker that taking protein powder, also taking steroids to build the body. And in the market, there are many powder. There is a combination of the protein powder. Light. अभी सुनाई दे रहा है हमारी लाइट गई?
Yes, sir. अभी
अभी चालू था, वीडियो पॉज हो गया था, वीडियो पॉज हो
अभी तो
गया
दिख रहा है ना?
हाँ, अभी
सर दिख रहा है।
हाँ ठीक है चलिए. So this is a very critical disease, ABN of the hip. We will be discussing about them. Okay, so now first this is the hip joint. Now this is the hip bone. This is the hip bone. Now one hip bone on one side, one hip bone on other side, both together are making complete hip structure. So there are two hip bones, one hip bone this side, one hip bone this side. This hip bone is made by three bones. There is a combination of three bones. इस हिप बोन में भी तीन हड्डियां मिलती है, right? Now, what are the three bones? We'll discuss. वो तीन बोन कौन सी होती है वो हम समझेंगे. Give me 1 minute. This is the back side. Okay. Fine. This hip bone is made by three bones. Upper bone, we can see this. This is called iliac bone, ilium. Very bigger bone, ilium. So this is the ilium bone here. ये जो bone है ना, जो ऊपर ऐसे feel करिए. Can you feel this bone? That is the ilium bone. This is the ilium bone. इसे ilium bone कहते हैं. ऐसे चलिए. जो ऐसे मटका लेके चलते हैं ना, ऐसे वो इलियम बोन पे ही लेके चलते हैं. पहले जमाने में चलती थी ना, ऐसे कुएं से पानी भर के ला रहे, नदी से पानी भर के ला रहे हैं, तो वो इलियम बोन के ऊपर मटका रख के चलते हैं। इलियम बोन इज वेरी स्ट्रांग।
सब बच्चों को भी बिठाते थे
क्या?
पहले,
बच्चों को
बच्चों को
गोद
भी
में बिठाते हैं ना,
बिठाते थे
बच्चों को
पहले।
गोद में
हाँ,
बिठाते हैं
बच्चों को ही
ऐसे ही।
बिठाते हैं यहाँ पे कमर में, है ना, दैट इज इलियक बोन,
Yes.
राइट? सो द अपर बोन इज द इलियक बोन, and the lower bone, this is the upper part of the hip bone. Then we can see the lower part where we sit, we can feel the pointed part. जहाँ हम बैठते हैं नीचे pointed part feel होता है,
Sir.
कहते हैं seat, seat where we are sitting, seat. So there is a lower part of this bone, that is seat. Seat कहते हैं, that is ischium bone. Ilium is upper part and the lower part is seat, that is ischium bone, right? And the middle part is pelvis. So I will show you in the image. Okay, I will show you image. I will show you presentation. Only 1 minute. Look at this image. So we can see this is the ilium bone, upper bone, right? This is the lower bone where we are sitting. We can see ischium bone. It's written ischium. This is the lower bone where we are sit. And upper is ilium. Got it? Then remaining one, this is the pelvic bone. Pelvic bone. Now the wonderful things is this, all the three bone together are making this cavity. This is the cavity. In this cavity, there is a uterus. There is a urinary bladder. And there is a rectum. इस कैटेगरी में, इस कैविटी में 3 स्ट्रक्चर पाए जाते हैं inside. On the back side, there is a rectum. So now first focus on this image. We are discussing the hip bone. The upper bone is the iliac bone, ilium bone. The lowermost of the bone where we are sitting, that is the ischium bone. That is the ischium bone, right? On the bone of the front side, that is the pelvic bone. We can see now. So hip bone is made by 3 bone. I will repeat. Ilium bone is the upper bone. Ischium bone is the lower bone. And the front side bone is the pelvis. So there are 3 bone combination are making the hip bone. So this is the ilium. Ilium. Where we are sitting, that is the ischium. On the front side, there is a pelvis. Pelvis bone. All the 3 bones are very much important. All 3 bones together are forming the hip bone. So now we see this structure is the very important structure. We can see this is the cavity. This cavity, inside this cavity, there is a three very important structure. Number one, rectum on the back side, urinary bladder in the front side, and uterus in between. So all the three very important organs are fully secured within this cavity. ये तीनों के तीनों स्ट्रक्चर इस कैविटी में सेक्यूर्ड रहते हैं. That's why we know if the person is suffering with any disharmony of the hip bone, there might be problem with the urinary bladder, like the more frequency of the urine, or some problem of the rectum, like stool related problems. During the pregnancy, when the uterus pushing the rectum, female are suffering with the piles. And when the uterus pushing the urinary bladder during the pregnancy, there is a more frequency of the urine. Have you seen that thing? ये आपको पता है ना कि प्रेगनेंसी के समय में
Yes,
यूरिन
sir.
होल्ड नहीं होता है.
Yes,
That's very common.
Very common. Why? Because uterus is in the center. In the front side, the urinary bladder. In the back side, there is a rectum. All three together in this, we can tell, hip cage. Hip cage. Got it? So in this way, we should know the many things about this. Like, so look at this bone. Look at this bone here. Hip bone. We can feel this pointed part in the front side. When we talk about the pointed part, it is called spine. The meaning of spine means pointed part. So this is the iliac bone, and we can tell the spine of iliac bone. Right? Because it's in the front side, so we are telling anterior spine of iliac bone. And because of it's in the upper part, so we are telling superior. So anterior, superior iliac spine. This is the name. In the short, we are telling it ASIS. Anterior, because in the front side. Superior, because in the upper part. Iliac spine. So now it is a very important structure, and you should feel it. You have to feel it here. You can feel one pointed part here. You have to feel this. आपको ये पार्ट को फील करना आना चाहिए. Right?
yes, sir.
We can feel this anterior part. That is called spine. Got it? So when we talk about the pointed part is called spine. We can see here. All the pointed part in this, these all are spine. This is spine. This is spine. All the pointed part are spine. If they are in the front side, we are telling anterior spine of the iliac bone. And if they are in the back side, we are telling posterior spine of the iliac bone. If they are in the upper part, we are telling superior. And if they are in the lower part, we are telling inferior. Okay. So now, I will show you in this other image. If we look at this image, Just look at the iliac bone. This is the iliac bone, right? So all the pointed part, they are called spine. Look at here. So this is called spine. This is called spine. Even in the back side, we have spine. I will show you shortly. In the back side also, the pointed part, that is also spine. They are in the front side, so we will tell anterior. This is also in the front side, we will tell anterior. But because in the upper part, we will tell superior. In the lower part, we will tell inferior. Right? So we are telling anterior superior iliac spine, posterior superior, anterior superior iliac spine. Okay. So the upper is called anterior superior iliac spine. I will write once again. This is called ASIS. And this is called AIIS, means anterior superior iliac spine, anterior inferior iliac spine. So just we have to remember these two parts, ASIS and the PSIS. So let's feel the ASIS. Why we have to feel the ASIS? हमें ASIS को क्यों फील करना है? क्योंकि हमारा स्टमक मेरिडियन यहीं से गुजरता है. अब आपको ASIS ही नहीं पता तो आप अंदाज से तुक्केबाजी में स्टमक मेरिडियन ढूंढते हो. The stomach meridian crosses through the ASIS, right? It passes through the ASIS. Searching the ASIS is not the difficult task. Just palpate here. And we are palpating. When we are doing the treatment of the patient, we are palpating it very regularly. So just we can palpate here. On the side, little. Here. This is the ASIS. We can feel it. The pointed part here. From the center near about, it's a 4, and 2 finger. Can you feel it? क्या आप इसको फील कर पा रहे हैं? ये एक उभरा हुआ भाग है, नुकीला सा.
Yes, sir.
कितने लोग फील कर पा रहे हैं? यहाँ पर एक उभरा हुआ सा है.
Yes, sir. Feel all right.
Yes, sir.
Are you able to feel it?
Yes, sir.
The both ASIS should be at the same level. If the both of ASIS are not on the same level, then this is called pathology, right? The most important is ASIS, because if we found the ASIS, then going 1 inch down, 1 inch medial, we will get AIIS. So suppose we are getting ASIS here, then 1 chun inner and 1 chun down, that is AIIS. In this way we are finding out. तो सबसे पहले हमें फोकस ASIS पर ही करना है. AIIS पर अभी इतना फोकस नहीं करना है. First we have to focus on ASIS, because there are many muscles attachment on the ASIS. Stomach meridian passing through the ASIS. There are many other structure passing through the ASIS, and when patient in front of us, we are measuring both sides of the ASIS. Right. Now, when we are doing Pavan Muktasana, you are knowing that how to do the Pavan Muktasana. चलिए सभी लोग पवन मुक्तासना के लिए तैयार हो जाइए. Everyone lie down and have to do the Pavan Muktasana, because then you will able to feel the movement of flexion. तभी आप flexion की movement को feel कर पाएंगे. So let's see now. So look at here. We are doing this movement. This movement is called flexion. इस movement को हम कहते हैं flexion, right? But we are doing, first we are lifting the any leg up, that is called flexion. Flexion of hip. We are bending the legs and bringing the knee toward the body. Do this much only, right? So this is called Pavan Muktasana. So in this movement, we can see we are doing flexion movement here, but we are doing flexion movement. And during the flexion movement, we are using the muscle who is doing flexion, who is pulling the thigh toward the abdomen. So these groups of muscle are called flexor muscles. So there are many flexor muscles. We'll discuss three. कई सारी फ्लेक्सर मसल्स होती हैं, हम उनके बारे में डिस्कस करेंगे. But there are mainly three flexor muscles who are doing this movement, and if these flexor muscles are disturbed, then we will see many different types of the disharmony. कई प्रकार की disharmony को फेस करेंगे. So let's see now.
So please mute everyone, so it's disturbing.
So in the hip joints, we are doing many movements. The first movement, that is called flexion movement. The flexion movement just I did, Pavan Muktasana or leg raising. So for doing the flexion, mainly we can see there are few muscles are involved. Number one, iliopsoas. Number two, rectus femoris. Number three, tensor fasciae lata. And number four, sartorius. Today, this will be your task, that you have to remember the name of these four muscles. आज का आपका टास्क रहेगा कि आपको ये चार मसल्स के नाम याद रखने होंगे. Iliopsoas. You can say here ilio. What is the meaning of ilio? Because this muscle is over the ilium bone. ये हमारी मसल इलियम बोन पर ही होती है. That's why the ilio. Then the psoas, I will discuss that muscles. So iliopsoas muscles, the rectus femoris muscle, the tensor fasciae lata, and the sartorius. There are four group of the muscles. There are four muscles, and they are helping us for doing the hip flexion. इन्हीं मसल्स की मदद से हम हिप फ्लेक्शन कर पाते हैं, राइट? नाउ so let's see here. So now I will share you the movement of these muscles. So look at here in this image. We have to do this movement after learning this. So we can see in this image, this is called hip flexion, right? Hip flexion. Now the involved muscle. Number one, which is a very important muscle called iliopsoas. So this is the iliacus muscle. We can see iliacus muscle, how it's located on the ilium bone. ये कैसे ilium bone से चिपकी हुई है, right? And the other muscle that is called psoas muscle, the psoas muscle is the bigger muscle who is coming from thoracic 12, lumbar 1, lumbar 2, lumbar 3, lumbar 4, and lumbar 5. From thoracic 12 to all the lumbar vertebra, the psoas muscle is coming. Then it's it with a combination of iliac bone, iliac muscle. Then the combination is called iliopsoas. इस combination को हम कहते हैं iliopsoas. Got it? The primary muscle, if you ask me who is the main muscle, I will tell the psoas is the main muscle. Psoas is main muscle, but iliac is the helpful muscle, iliacus muscle. But the combination is called iliopsoas. And they are the very bigger muscles and doing hip flexion. ये हमारी बहुत ही महत्वपूर्ण मसल है जो हिप फ्लेक्शन करने में हमारी मदद करती है. Right? We can see how they are lifting the legs up. Got it? So now, if the person is suffering with a lumbar vertebra problem, lumbar spondylosis, slip disc, any disharmony in the lumbar vertebra, then male might not be having this movement very easily. Now, suppose you want to find out whether your iliopsoas muscles are involved or not. It's simple. Do this. Then you have to ask the patient, perform this action. अगर आपका पेशेंट ये एक्शन ठीक से कर पाता है तो समझ जाइए कि उसकी इलियोसोस मसल ठीक से काम कर रही है, राइट? Okay. Sometimes there is a very tight iliopsoas muscle. अगर किसी की iliopsoas muscle बहुत टाइट है तो हम इसके लिए एक टेस्ट करवाते हैं जिसे हम बोलते हैं थॉमस टेस्ट, है ना? उसका नाम ही है थॉमस टेस्ट. द थॉमस टेस्ट वी आर डूइंग to search the tightness of iliopsoas muscle. So I will show you in this image. Look at here. अगर आप इस टेस्ट को देखिए, can you see this test? When the person is doing this movement, how the other knee is lifting up. Patient ने पवन मुक्तासन किया और उसका पूरा नी ऊपर उठ गया. Why? Because iliopsoas muscle are tight. I will repeat again. You try to understand in this way. So look at here. Suppose this muscle is very tight, very, very tight. Tight means it's contracting like this and it's trying to pull this like this. Okay. Now, if I am doing Pavan Muktasana from this leg, so person will be lifting this leg like this. Got it? Person will not able to keep this leg on the bottom, down. So in this way, this muscle is the muscle of flexion. So flexion means this movement. This movement is the movement of flexion. Even bending the knee, this movement is the movement of flexion. Right? So these are the movement of flexion. If the iliopsoas is very tight, it will keep on holding like this. It will not release the leg down. It will keep on holding like this. ये पैर को पकड़े रहेगी. Iliopsoas muscle, if it is tight. Okay. So even suppose someone is lying down easily, if you ask them to lift the other leg, so it will become like this, right? So we are doing Thomas test. Ultimately, to find out the tightness of the iliopsoas muscle. So you have to remember the number one muscle of today, the iliopsoas muscle, which is called the muscle of flexion. The second muscle you have to remember that I will show you in the image now, very important muscles. Look at this image. Tomorrow I will discuss all the tests of these muscles, but today, so we already have discussed the muscle iliopsoas. Now the muscle in the thigh, that is called rectus femoris. We can see the very bigger muscle, rectus femoris here. Right? This is the rectus femoris. How it's moving the thigh toward the abdomen. ये कैसे थाई को उठाकर एब्डोमेन की तरफ मूव कर रहे हैं, we can see here. Right? This is called rectus femoris muscle. We can see. So we have to remember the second muscle, which is the muscle of flexion in the front side of the thigh, that is rectus femoris. Once you remember the name of all the muscles, then we'll discuss the test of each and every muscles, right? Or whichever is possible. Then two more muscle, one muscle on the inner side and one muscle on the outer side. Just we remember these names, the one muscle in the outer side, one muscle in the inner side. Then the four muscles we will learn that they are called the flexor group of muscles. So the outer muscle, this is called tensor. This is the outer muscle, which is called tensor fascial lata. इसे हम कहते हैं टेंसर फेशियल लाटा. ये हमारा जो गॉलब्लैडर मेरिडियन होता है ना, वहीं से जाता है टेंसर फेशियल लाटा, द लेटरल साइड. हैव यू सीन दिस एरिया? दिस वेरी टाइट समटाइम. दिस एरिया, द साइड एरिया इज वेरी टाइट. This is the tensor fascial lata on the side. Sometimes it's very tight now. It's becoming like this. So person is having very tightness here because of the tensor fascial lata. It's a very common with the person who play football or athletics. They are getting the tightness of this tensor fascial lata. So this is also holding your hip joint, hip area, and helping in the flexion, helping in flexion, right? And one muscle from inside, one muscle, the last muscle from inside, that is called the muscle of flexion. So look at in this image. Now this is the last muscle which we are discussing here. That is sartorius muscle. Sartorius. We can see this is the muscle. This crossing. It's starting from. There are many muscles starting from ASIS. Anterior superior iliac spine. What we have discussed. The sartorius is starting from the ASIS. We can see. The tensor fasciae lata is starting from the back part of the ASIS. Right? So we can see this is the sartorius muscle. It's crossing your thigh. ये आपकी थाई को क्रॉस करके जाती है. So starting from the ASIS, then you can see how it's going to the medial part of the knee. आपके घुटने के अंदर जा रही है. Now person is telling you, doctor, I'm suffering with the knee pain. Then we can see how the knee pain is because of this sartorius muscle. Right? So in this way, this is your task of today. Number one, you have to remember the name of these four muscles: iliopsoas, rectus femoris, tensor fasciae lata, and sartorius. Right. I already have discussed with you the psoas major muscle starting from T12 to L5. Right. And all other muscles starting from ASIS. Rectus femoris is starting from AIIS. Okay, but no problem. You just remember they are starting from ASIS, if you can remember, because I am going to discuss again these things tomorrow. So mainly, most of the flexor muscle is starting from ASIS. Okay. So they are the flexor group of the muscles today we have discussed. So now you have to homework. Homework number one. Remember all the flexor group of muscles. Homework number two. Everyone has to tell me which is the asan. Asan, you know, yogasan. Who is connected with the psoas major? Who is connected with the means iliopsoas? Like which asana we do? Like I did Pavan Muktasana. Pavan Muktasana is connected. So you have to do Google search and the name of the muscle and connected asana. You have to tell me, because if you're doing little search, then the name of the muscle will be in your mind, and even by asana name, you will also able to remember the name of the muscle and the movement of the muscles, right? So the four muscle sartorius, which asana? For the sartorius, iliopsoas, tensor fasciae lata, and rectus femoris. So four muscles you have to remember. This is the task of today. And you have to write the name of the four muscles and you have to put in the group. If possible, then make the small diagram, right? A small diagram and put in the group, any group, wherever you are. Okay. And tomorrow I will ask you, tell me the name of asana which is activating these four muscles. Okay, so enough for today. So this is the day one. And because it's a morning time, so what I think, we will do all the asanas which is connected with a specific muscle. That will be okay? सही रहेगा ना? अरे वाह, ये तो पटाखे चल गए. Okay, if we do all the asana connected with muscle, right? Okay, chalo, done. Wonderful. So well done everyone. Have a wonderful day. चलिए एक बार फिर आतिशबाजी. Now we'll see you tomorrow morning. कल मिलते हैं, ठीक है? Bye bye. Have a wonderful day.